Good day, HeARTation community. We all know what it's like to be afraid of something, whether it be a lightning or thunderstorm, a trip to the doctors or dentist, being stuck in an elevator, the fear of dying, or even losing someone which is dear to you. This is fear, and it's perfectly normal. It's a normal reaction, one that warns our body to be careful. Most likely you've heard the following acronym for fear: F false, E evidence, A appearing, and R real. Fear. In most cases, fear is just our brain's way of attempting to keep us safe. Our brains are programmed so that sometimes when things are blown out of proportion, we don't want to take unnecessary risks and are able to make it through another day in our respective lives. So, how can we move forward knowing that fear will show up in our lives? How can we transform this depleting emotion into something powerful and fulfilling? In this series, I bring to you 2 effective strategies you can apply by using CBT or cognitive behavioral therapy as a form of therapeutic management. Now, CBT stresses the importance of facing fear on a regular basis. The more you practice, the faster your fear fades away. So for my first strategy of facing fears, I use something called the exposure therapy. So exposure involves gradually and repeatedly entering feared situations until you feel less anxious. So you start with situations that only cause you a little bit of fear and anxiety, and you work your way up to facing things that cause you a very great deal of fear and anxiety. Then make a list of situations, objects, or places that you fear. So we arrange them in order from the least scariest to the scariest. Starting with the least scariest situation or object, repeatedly take part in that activity or face that situation. Now I'll give you an example. If you have a phobia or fear of snakes, start by acknowledging to yourself that you want to accept your fear and intend to change it. Then start looking at pictures or images on your phone or in the TV, or even making to the trip to the zoo or even a reptile farm. Now keep doing these activities as often as you can, because the more frequently it is done, the better you cope with addressing your fears until you start feeling less anxious doing it. So this may take like weeks or months or probably longer, but the idea is do not give up. Once you face that specific situation or object many different times without experiencing much anxiety, you are ready to move on to the next step on your list. My next strategy, the second one, is about managing your fears and how you try to avoid a relapse. And this is a continuation of my first strategy from the exposure therapy. How do you do that? By giving a reward. So sometimes we slip back into old habits or actions, and the fear starts kicking in yet again. So this is called a relapse, and it is normal to have lapses, especially during stressful times, events, or even when moods are low or you might be tired. But we don't want to turn these lapses into relapses. How do we avoid relapses from occurring? Practice regularly your skills that you learn through exposure therapy. Make a schedule of what skills you're going to work on every week, then keep track of your progress. If you had a lapse, try figuring out what situation led you to it. This allows you to plan out and cope with a difficult, fearful situation the next time or whenever in the future. And remember, lapses are normal and can be overcome. Reward yourself for all the hard work that you're doing, like buying yourself something useful or going out for a meal or even watching your favorite movie. You deserve to treat yourself. If you're experiencing overwhelming fear or phobias, please do consider working with a therapist. And for those of you who have fear and predict you can manage on your own, do try these 2 strategies and discover how fear begins losing its ability to rule you and dictate your decisions. Yours in HeARTation.